I'm going to look at how tobacco contributes to mortality, morbidity, and non-communicable diseases. We're talking about lung cancer, asthma, and heart disease. In terms of the things that kill us globally, it's the number one contender. In terms of actual numbers, non-communicable diseases themselves together are responsible for about 70% of deaths worldwide, and tobacco is the leading culprit. The World Health Organization has estimated that tobacco use, smoking and smokeless, is currently responsible for the death of about 6 million people across the world each year, with many of these deaths occurring prematurely. This total includes about 600,000 people who are also estimated to die from the effects of second-hand smoke. We've learned the hard way in developed countries that this doesn't just cost lives, it costs economies, it costs society as a whole in a really significant way. So whilst the tobacco industry is making profits, we are paying for those profits, and the risk is imposed on society and on families. Developed countries have learned to deal with the tobacco epidemic through effective policies. For developing countries, it remains a major challenge to tackle this epidemic. We've had the advent of very good controls, like the World Health Organization's Framework Convention on Tobacco Control, or FCTC. This framework really wraps up in one package all of the interventions and measures that effectively control tobacco use, like appropriate advertising. In the developed world, countries take this up quickly. But it's a harder ask in developing countries where there are issues of capacity, budget, and how much training is in place for health professionals. The FCTC is slower to implement, and awareness of the issues isn't high. You and I will take for granted that all the harms of tobacco are really well known. Not so in developing countries. In these countries, it's still like it was for the developed world in the 1930s and 40s, when we had doctors advertising the benefits of cigarettes. Developing countries really need to know the basic information. The tobacco industry are aware of this, and as the markets start to shut down, as things get tougher in the developed world, the markets shift to developing countries. In the Southeast Asian region and Indian subcontinent, there's a huge market, and that's where the industry's efforts are going. Fortunately, more and more countries are starting to get an awareness of the issues. In China, we are seeing restrictions on smoking in public places and transport hubs. Increasingly, countries are aware that things like plain packaging and graphic health warnings work well, so they're catching up slowly. But there's probably a 10 to 15-year time lag in terms of the effect of controls. There's a bit of a delayed effect, and we're trying to close that gap. Of course, with non-communicable diseases, the lessons learned from industry tricks in tobacco have not really been learned yet in relation to alcohol and food, but we're working up to them. Often, it's the exact same copybook of tricks. If tobacco were discovered today, it would never make it into the market because of the kind of product that it is and the harms it confers on people. There's hardly an organ in the human body that is not impacted by tobacco. Tobacco is culturally embedded in many ways in many countries. Nicotine is a powerfully addictive drug, more addictive than heroin. Some people say that governments are addicted to the revenues they get from taxing tobacco. Whilst it would be lovely to go back in time when tobacco first started coming into prominence, the 1600s, and stop the epidemic from starting, we cannot. But what we do have is the FCTC, which is trying to eliminate tobacco within a legal framework. It's an ongoing and ever-changing battle, where we need to monitor industry for new tactics, like the introduction of e-cigarettes. This is a very controversial issue, just at the moment. We call them e-cigarettes, although they are also called ENDS, or electronic nicotine delivery systems. So there's a range of different types, but I guess e-cigs is the one people would be most familiar with. So the challenges that we've got with e-cigs is that there's a great variety of them. Typically there's no quality standards put in place, so you're never quite sure what you're getting. Usually they do contain nicotine. Australia's National Health and Medical Research Council has stated that there is currently insufficient evidence to support these claims, and further research is needed to enable the safety, quality and efficacy of e-cigarettes to be assessed. The short version is safety not proven, ability to contribute to smoking cessation not proven. What probably is proven is that it's a nice sort of weapon for the industry to undermine the kinds of public health measures designed to keep people alive. Latest information from the United States shows huge uptake in e-cigs amongst young people. So the question is, do you get dual usage? Do you get people taking up e-cigs who would never have smoked before? Is it a gateway to smoking?